Well, good afternoon, Victoria. As we have communicated during past briefings, we will use these press briefings to address the public when new information arises and becomes available or the circumstances warrant it. On that note, COVID-19 has become increasingly widespread in our community. We have a spike in positive case counts of COVID-19, and it has impacted our hospitalizations. For that reason, our Public Health Authority, Dr. John McNeill, will address the public about this situation. As you may know, Texas Education Agency officials announced Friday that they are allowing schools to delay on-campus instruction. To speak on that topic will be Victoria Independent School District Superintendent Dr. Quintin Shepherd. Before we get started, I'd like to announce today's information about the status of COVID-19 in our community. As of yesterday, and once again I remind you that we do have ongoing investigations, we'll provide an update on today's case counts at the end of today. As of yesterday, we had 68 new cases reported of COVID-19 in our community. That brings us to a total case count in Victoria County of 2,475. That's 2,475. And that's recovered, 1,155. Active, 1,297. Hospitalized is at 108. And recovering at home is 1,189. So remember again that these case counts will be provided at the end of today. Following today's press briefing, you can access our daily case counts, like I mentioned, at the Victoria County Public Health Department's Facebook page, or for more information, you can of course visit victoriatxoem.org or call our COVID hotline at 361-580-5796. So with that, I will let Dr. McNeill address you.
Thank you, Ashley. Good afternoon, and thank y'all. I need to go over several things with you, and you know, we get a lot of different information points that are brought to us basically from the public, and people have questions about things that they want to know about. So I have a list of different items that I'll go through, and hopefully I'll be able to dispel some false statements and stuff that have been out there, and we can get you straight to where you need to be. The first thing I want to talk about today is the current hospitalization status. I mean, you know, since the very beginning, that's always been one of our key points and something that we've really looked at. And communities and cities and states get in trouble when they start to lose the ability to care for the people that are sick. And we've seen that in the bigger cities. We saw it in New York. We're seeing it right now in Houston. We're seeing it in the major metropolitan areas. And we're seeing quite a surge at our own hospitals. So I want to address that and tell you what our hospitals are doing and tell you where we stand, basically, from that standpoint. As of just a few minutes ago, probably 15 minutes ago, we have about 125 patients in our two hospitals, in Citizens and DTAR hospitals. So we have about 125 patients that are hospitalized. You know, these numbers are hard to nail down because, you know, that's a fluid situation. We have people coming and going. Patients are discharged. Other patients are put in their place. So about 125 right now. As far as ICUs, we have multiple patients in intensive care units and multiple patients on mechanical ventilation. So as far as ICU goes, I don't have an exact number because that number changes. Patients come in and out of ICU based on their medical needs. I know that there's just a few ICU beds left, okay? So, and those could fill up at any time. We're always very careful about that. And one of the reasons that that is concerning is because it's not like in non-pandemic situations when we can just take patients and transfer them where they need to be. We routinely transfer patients to higher levels of care in either Corpus, San Antonio, or the majority of them to Houston. So that's not an option right now because those hospitals are full, and we have pretty much a continual list of people that are calling us to transfer patients to us from smaller areas. And there are a lot of patients that are in smaller hospitals in this region that would be transferred if there was room for them, but there's just not room. I mean, I've heard of patients that are having to be transferred several hundred miles just to get to definitive care. That's a problem, and that's where, as I've always said, the rubber hits the road as far as this pandemic goes, because if it gets to where a population can't take care of their sick, then it escalates very quickly from there. So I will tell you this, both hospitals are working very hard to open new beds and open new COVID beds. They've identified other wings that they can isolate patients and put them in. We've done that. Certainly, you can tell we've done that if we have 125 patients in those two hospitals. There are other wings that they are opening right now we're working on. We're working on more negative pressure beds. A negative pressure room is a room that has a negative pressure in it that basically doesn't allow the virus to float around in the air in there and infect other people. Especially in patients that are getting breathing treatments and stuff like that, that's a danger, and that's something we really worry about. And it has been shown to be the cause of a lot of transmission of this virus. So we're very careful about that. The other things is that we look at the status of the emergency departments. Right now, we don't have any patients waiting in the ERs, and that's a good thing because that's pretty much the overflow area. When all the ICUs are full, then we have to move those patients somewhere, and we have to move them to a critical care area, and the other critical care area is the emergency department. So we call that boarding patients. It puts the emergency department in quite a strain. Any of you that have gone to the emergency room know that sometimes there can be a wait to get treated because there are a lot of patients there that need care, and you're triaged based on the severity of your illness. So a lot of times if these beds are filled with COVID patients, then it makes it harder for us to move patients in and out of the emergency department. So that's another issue that we're dealing with, but it's something that we watch very closely. Let's see here. The other thing was that we are at widespread community transmission, and this is what happens with widespread community transmission. I remember a few months ago getting up here and saying, you know, we want to try not to get to widespread community transmission, but we certainly are there. And I tell people this all the time. If you go out without a mask and you're around a bunch of people that you don't know, then you pretty much ought to consider yourself exposed. It's that prevalent out there. This virus is everywhere. So, testing in Victoria. Testing is another dynamic situation, to put it nicely. You know, some days we have a lot of tests available, some days we don't have as many. We're at the mercy of the laboratories. Now, both hospitals have really ramped up, and we have a lot more testing capability than we did. The private labs are doing it, and there are more private labs coming on. I got a call from another one today that is going to be now accepting specimens. So it's a matter of getting the specimens collected. That's one issue. The other issue is getting the actual swabs to collect the testing data or to do the nasopharyngeal swabs. And the other thing is the reagent that it takes to transport them. And then it's the lab that has to be able to run the test. For a while, our biggest lab had to stop for a week because they were 40-something thousand cases behind. They couldn't catch up. So they had to stop just to be able to test. I've heard patients that can get their results back in 2 to 3 days, and that's not uncommon. But then I've had a patient yesterday that didn't get their result back for 14 days. So it just kind of depends on how many are out there. We don't have, we're not doing the walk-up testing that we did before. That was done by the military, and they came in. But y'all know how that went. We did 747 tests in one day, and I think 450 something the next day. So there were a lot of tests. There were a lot of tests done. Let's see. Now, as far as the reporting goes, as far as the reporting of these numbers, you know, there's been talk that our numbers may be exaggerated, and that our numbers are escalated or increased by just somebody has a fever and the doctor says, "Oh, you've got COVID." So, well, let me tell you, in this day and age, when a person comes in and they've got fever, they've got chills, and their body aches, and they feel terrible, and they live in Victoria, then they probably do have COVID. Now, we don't diagnose a person with COVID until we have a test. So out of the 12 or 1,500 or 1,400, what was the number today? It's a lot. Whatever the number was today, I can tell you there's only 3 or 4 cases that we did not test that we claimed as COVID positive. So the idea of a person being included in these numbers that we haven't tested is just not true. So those are real numbers. That's real numbers. Now, that being said, look at the number of patients that I see in the emergency department that we basically send home without a test. If they come in, they're young, they're healthy, they're not short of breath, they don't have any systemic symptoms. In other words, it doesn't seem that the disease is all over their body. It's just a cough or whatever it is, or maybe a headache, or maybe loss of taste or smell. Whatever it is, if they're stable, then there's really nothing, there's no use to test them. There's no use in testing them. We tell them to go home and quarantine them. If they're positive, what are we going to do? We're going to send them home and tell them to quarantine. If they're not tested, what are we going to do? We're going to send them home and tell them to quarantine. Okay? So we're conserving precious resources, and that's what we do. Now, Contrary to what you may have heard, we do not, when we send someone home with a presumptive diagnosis like that, we do not include that in the numbers. So the numbers that are out there are actual numbers that have been tested and were positive. As far as false positives and false negatives, I can tell you that as far as the numbers of patients that get tested that don't have the disease but are told that they do, that number is very, very, very small. Very, very small. I haven't seen any yet, or maybe one. But I'm telling you, but then there can be false negatives. So if those numbers were going to exaggerate in one way, the numbers would actually be less than what they are. So I think our numbers are very sound. We've been very careful about that. We don't just say, well, this guy looks sick, I think he's got COVID. Put him down on the list. We don't do that. And as far as repeat tests, we'll tell you the number of tests, but we don't count those people twice. Okay. So those were just some of the issues. Now, we're going to talk in a little bit, and I'm going to tell you about a study as far as children and the transmission rates of children. There's a new study that came out of South Korea with 60,000 patients, and we'll talk about in a little bit because I'm going to talk about the orders as far as kids going back to school. Dr. Shepherd from VISD and myself and David from the health department and the judge, the mayor, everybody in our department, everybody that's been in this thing from the beginning has spent a lot of time going over the data. We've gone over everything, and we'll have some orders for you that we'll announce when Dr. Shepherd comes out. So they don't let me out of here until I say something about wearing masks and social distancing. And there's been some question about people saying, well, I'm wearing a mask, so I don't have to social distance. Well, masks have not now, nor have they ever been, a replacement for social distancing. Masks should be used at all times, of course, in the state of Texas. Right now, we know that. But masks are made also for when you can't social distance, when you're in an area that you have to be next to someone. And if you both have a mask on, especially if it's a good facial covering, then your chance of spreading the disease will dramatically be decreased. We know that from countless studies, and we know that from actual data from watching how people breathe out when they have COVID. So there's a lot of good information out there, so we're sure of that. So wear your mask, social distance when you can, and I think that's it for now, Ashley.
Thank you, Dr. McNeill. At this time, we will open it up for questions specifically related to Dr. McNeill and the points that he addressed just now.
Dr. McNeill, on Friday evening, there was 4 outbreaks publicly reported in one day, including one facility with over 90 cases. With the understanding that there's a massive backlog, a lot of investigations, can you explain why it took so long for the public to be informed of these major outbreaks, that cases where their loved ones are living?
Well, I think that you kind of answered your own question when you said that about there being so many. At one point we had several hundred patients that we just couldn't contact. We brought in extra testers from the state. We brought new people in. We trained them. We've even had other people come in and help us. I will say now that, and David could address this better than I can, but I do know that we are currently caught up because we were able to let the state take over a bunch of those cases. So when we started doing all those things, we started seeing these outbreaks. As far as calling it an outbreak or calling it this, I mean, that's just part of widespread community transmission. I had someone ask me the other day, they said, well, is this an outbreak? Is this an outbreak? And I just said, look, Victoria's an outbreak, okay? It's everywhere, okay? And when you have one group in one area, then you're going to have a lot of tests positive from one area. So if you look at the overall picture, it's just basically this is a consequence of widespread community transmission. Now, in a perfect world, we would have a room with 40 or 50 contact tracers, and everybody would be contacted the day that they had their diagnosis, and we would be able to do this. But this is a problem in Victoria. This is a problem in Texas. It's a problem all over the nation. So, basically you do the best you can with the resources that you have, and I applaud our health department for doing what they've done.
And Dr. McNeill, in terms of both the county jail and the nursing homes where the outbreaks have been reported, what steps are being taken to mitigate further spread of the virus there?
Well, I can tell you, first off, I'm the medical director at the jail, so I'm very familiar with that one for sure, and then I'll tell you about the nursing homes. But pretty much with the jail, immediately when we identified the first patient, we took that patient out of population and put them in a cell by themselves. Then we ordered the testing of every person in the cell that person was with. There were 8 in that cell. 7 of them came back positive. So that was pretty straightforward where it came from. We isolated that cell, and knock on wood, it's been pretty good so far. I mean, you worry about outbreaks in confined spaces, especially in a jail. We've seen what has happened in other cities and bigger municipalities in their jails, several hundred positive with multiple deaths. We certainly did not want that going on. The jail has also limited the number of people that they've had in there. They've tried to do what they can to keep everybody separated. The employees are all wearing masks. We're practicing social distancing. We've changed the ways that we give medications. We've basically done everything that we could to try and stem this. And to be honest with you, when we finally got that first positive at the jail, my thought was, we got off for a pretty long time without having one. So I think we did a very good job there. And I know that once that first person became positive, we were on it literally within 20 minutes.
And is it believed that the staff members who were infected, that they got that from community spread or from that one resident of the jail?
Well, honestly, we even at that time, we were not having our employees, I mean, the jailers and the people were not that close. I mean, sometimes they have to get in there and get near the patients, but they were always protected. They always had N95 masks on when that happened. So it's hard to say with widespread community transmission like that. I mean, people are going to, it got in there somehow, and it's not like we let the people out in the jail during the day to go run around and come back. So it had to be brought in. So, I mean, that's just part of it.
Dr. McNeill, you said that our ICU capacity or ICU beds are nearing capacity now, and just for those that don't understand, I'm curious, what does that new reality look like if and when we do reach capacity with the surrounding cities in our area also at capacity? What does that reality look like for our hospital system? Well,
it looks like worst case scenario. That's what it looks like, because patients are in intensive care units because they need just that. They need one-on-one monitoring. A lot of them are on ventilators. They're on different medications, and I've seen pictures and I've seen studies from the larger hospitals that literally had these patients in the hallway, and you just can't provide as good a care in an uncontrolled environment like that. So the mortality would go up, everything would be bad. Now, we're not near there. We can still put patients in the emergency department. We have brought in extra nurses into the hospitals, and we've got them from the state. That worked out very well. Department of Defense sent us nurses, and that really turned it around for us. It really helped us. That's still an option. I was on the phone with some people the other day that have the ability to get that done with us. I was talking to our senator and our state representative, and we're all working together real well, and we still have other options that we can pursue if it gets to that. So when I say that the ICU beds are compromised, I'm saying that they're getting full, but if need be, we can do more.
You spoke about testing too, and I'm curious, there's been seemed to be this narrative about, in an attempt to sort of mitigate the severity of the numbers, saying, there are increased case numbers, but we're also testing more as kind of perhaps an attempt to undercut those numbers. I'm just curious to get your thoughts on that.
It's always curious to me when people say, well, you're just testing more. Well, there's a reason we're testing more, because there's more of it out there. Okay, so if I test 100 people and 80 of them come up positive that I wouldn't have tested before, that doesn't change the fact that there were still 80 cases out there. So the numbers are going to go up the more you test, of course, but the bottom line is that the reason they're going up is because there's more disease out there. So either way you look at it, there's still more disease out there, and that's what we try and find out. And testing is very important. They're going to pool testing now, where they're going to start, supposedly, I read about this, they're going to start testing 20 people or a certain number of people, I think 20, at one time, and run them all in one batch. And if one comes back positive, then they know that there's a positive in there, and they have to go back and retest that 20. But if not, then they've saved a whole bunch of tests, because if all 20 come out, if that pooled specimen is negative, then they know that all 20 of those people, and the FDA just approved that pooled testing just a couple of days ago. So, and that's just a response to the numbers of this virus.
Dr. McNeill, what is the treatment protocol for COVID patients in Victoria hospitals? Do we have remdesivir? If so, are we using it on COVID patients?
Yes, we have protocols. Yes, they're based on CDC guidelines. We're actually very fortunate. We have a brilliant group of pulmonary specialists in Victoria. For a town of Victoria to have the 3 great pulmonologists that we have that work at both hospitals is remarkable. I've worked with them closely for many, many years. We also have an infectious disease doctor who is brilliant, who is able to help guide us with this. We have a lot of patients are getting multiple medications, including remdesivir when it's available. That's been kind of problematic because, it is on, it's allocated. So we get X number of doses, and we use it judiciously for the patients that need it the most. But yes, we do have protocols for that, and they are they're as aggressively treated as anywhere in the nation.
We have time for one more question. We do have Dr. Quintin Shepard in the next room waiting to come in, and Dr. McNeill will be available following the press briefing today.
Just to quickly go over the outbreak at the nursing home. I know obviously you're not the medical director at those facilities, but any steps you can speak to for what's being done there to mitigate the spread of the virus.
Well, everything possible as far as isolating those patients and massive testing. And the state came in, actually, for an outbreak like that in the nursing home. The state sent down their experts, and they did a lot of that. They did a lot of testing. We identified those patients, and we isolated them. And we're watching closely for any further spread. And hopefully it has stabilized.
Great. Thank you, Dr. McNeill, and thank you for your questions. At this time, we will welcome in Dr. Quintin Shepard, who is the superintendent of VISD. A couple of main points I wanted to reiterate that Dr. McNeill covered. We are at a widespread community transmission of COVID-19 in our community. We have 125 patients who are currently hospitalized as of today, after a few minutes ago. That's the latest update we had. And ICU numbers, of course, change throughout the day, throughout the week. So at this time, we have just a few left. And so that is something that our local officials are monitoring to ensure that we do have enough should anyone need to be hospitalized. It's a dynamic situation. We're all learning about this disease just as much as health experts are, just as much as you are. And so I thank you, Dr. McNeill, for being here to present a lot of good information to us, and you for listening and paying attention to the dynamic, evolving situation. With that, we'd like to allow Dr. Shepard to address the next step in this briefing, but also Dr. McNeill has an announcement he'd like to make first.
I wanted to wait and announce this at this time because the orders that I'm about to announce as far as our schools, certainly the VISD superintendent will be able to talk about those, okay? So, there's been a lot of talk about kids going back to school, and there's been a lot of things that we've looked at, and there's been a lot of controversy as far as what's the best thing for this. So I'll answer a lot of questions about this after we're through, but I'm going to read this order basically, and then we'll talk about it. Okay. Therefore, pursuant to the authority vested in me as the local health authority under Texas Health and Safety Code, Dr. John McNeill, hereby issue this order imposing the following specific control measures. First thing I want to say is that this order complies with executive orders, GA 28 and GA 29. And it does not restrict any services allowed by executive orders, nor does it, and does not allow gathering prohibited by the executive orders. It does not provide any detention, arrest, or confinement in jail for violations of this order. Next point, this order does not regulate the content of any instruction provided to students in Victoria County, nor does it regulate the scope or sequence of education provided to students in Victoria County. Next number. This order is not a blanket order restricting in-person instruction in religious private schools because it only restricts the place of delivering instruction within the county and does not order any school, whether public or private, to cease providing instruction or to close. The following restrictions are effective 12:01 a.m. July 21st, 2020 on all public and private schools offering secular education to students in one or more grades, pre-kindergarten through grade 12 in Victoria County, including all independent school districts in Victoria County, herein known as school systems. School systems shall not reopen schools on campus face-to-face for face-to-face instruction until after September 7th, 2020. Virtual instruction shall be permitted as per the school system's own plan. Extracurricular sports and activities shall not take place until school systems reopen for on-campus instruction. And finally, at least 2 weeks prior to the reopening for on-campus instruction and on-campus activities, the school or district shall develop a plan to be submitted to the Victoria County Local Health Authority for reopening campus activities instructions and make the plan available for parents and the general public. As a local health authority, I strongly recommend that parochial schools do not reopen for on-campus, face-to-face instruction until after September 7th, 2020. but this order shall not restrict in-person instruction at any parochial school offering religious formation education. This order is under my authority as local health authority, and I've signed it today. So we'll answer questions about the order. I'm sure there'll be some after that. But right now we have Dr. Shepard, who's going to go over some of the, for lack of a better way of putting it, the nuts and bolts of how this is going to work. I will tell you that I've worked with Dr. Shepard a lot recently, and Victoria is very lucky to have this gentleman.
Thank you, Dr. McNeill. Good afternoon, everyone. I come to you today with a heavy heart as we are mourning the loss of one of our VISD staff members. At this time, our thoughts and our hearts and our prayers are with their family during this difficult time. I do want to talk through some of the details as it relates to the order that you just heard about. I'm going to group my comments in three areas. So for those of you who are listening in and want to keep track, I'm going to talk a little bit about the calendar, and then I'm going to talk a little bit about registration, and lastly, I'm going to talk about technology and equipment. So as it relates to the calendar and the next steps, my first comments are for the students and the parents so that you can be aware. We are planning to have a virtual start to our school year with this order. We're going to push the virtual start back just a few days later than we had originally put forward in the initial calendar for the school district, and our virtual start for students will be on August 18th. So again, that's a virtual start for students on August 18th. Students who are listening to this, I want you to be aware, we sent out some social media today alerting you to this, but for all middle and high school students, we will be holding 2 town hall sessions specifically for you. It's going to be the 27th and the 28th. Because of the capacity of those Zoom meetings, we're going to break those into East High School and feeder middle schools, and then West High School and feeder middle schools on the 27th, July 27th and July 28th. That information went out today so that you can register for that. You can find it on social media if you're looking for that. Your voice is really important to us as we put together our learning plans, so please do plan on participating. For teachers and staff who are listening, I'm going to share some dates with this adjusted calendar and what it means for you. From July 27th through the 31st, VISD will offer training in Microsoft Teams. We believe this will help facilitate classroom instruction. July 30th and 31st are identified as campus work days for our new teachers. August 3rd, 4th, and 5th, elementary and secondary staff will have new teacher training. August 5th, 6th, and 7th, elementary and secondary instructional continuity remote learning PD sessions will take place. All teachers will complete 2 days of training from July 27th through August 7th to flex for the 2 days that we typically have off during Thanksgiving week. And all teachers can complete 3 additional days for which they will be compensated for training. Part of our pushing back the start of the school year is to make sure that all of our staff are as trained as possible and ready for a remote instruction given what we learned through this spring. We will post all of this calendar information on our website, and of course we will release it to the media so that there is there's coverage in the media so that families can be aware of what that looks like and what it means. I'm going to move to registration for just a moment. All parents who have not registered their children for the upcoming year need to complete registration as soon as possible. We must have accurate counts in order to build our classes. Parents are not able to select an instructional preference or to sign up to receive a device until your registration is complete. If you're having difficulty, please contact your child's school or the VISD Student Services Department. Although we're starting the year fully remote, it's still very important that we know each family's long-term preference for your children. We will be sending a new survey to all families that have completed registration on Tuesday. On this survey, we need families to indicate whether they want their children to remain in remote instruction for the foreseeable future, or if those families want their children to change to face-to-face instruction when that becomes possible for us. once we return to schools. This information is important because it will be used to build classes. Parents may change their preference 2 weeks before we return to face-to-face instruction or at the end of each grading period. With the ever-changing status of our community, we will need to survey families multiple times before we return to school. Please complete those surveys as you receive them, as it helps us in planning. I will apologize in advance for any inconvenience this may cause, but I will thank you in advance for helping to provide us with this information that is so critical for our planning. I'm going to talk just briefly about technology and equipment now. We have approximately 2,600 laptops on order and are hopeful that they will be delivered in the next few weeks. That will make our total since this spring of computers purchased approximately 5,200 computers total that we've purchased. We have 2,600 hotspots for families who have unreliable internet access. Of those 2,600 anticipated for the start of the school year, we're waiting on 1,200 of those to be delivered. Again, as you all know, deliveries are moving very slow because virtually every school district around the country is ordering laptops and hotspots right now. If you still have a device at home, please return it. We need to get that device ready for the start of this next school year. In preparation for this coming year, I am encouraging parents who are able to purchase a device to support remote learning for their students. One of my personal biggest worries at this point is not having enough devices, because we're finding it so difficult to get an accurate information from the surveys that we send out. If you are able to purchase a device, it means that someone less fortunate may have access to a device that the ISD has and can hand out. Surveys, for some folks, they've alerted us that surveys have gone into your spam folder. Please check there to make sure that you're getting that survey information after you've registered. If you have not registered, you won't get a survey. So just a little bit about the equipment that we do have and are anticipating for when we're able to return to school. At this point, we have over 150,000 face masks. I know there's been some questions on social media about whether parents need to buy a face mask when we do start school. We have about 150,000 face masks to get started in the school year. We have 1,400 gallons of hand sanitizer, and we're working on distribution into each of our campuses and classrooms now as well to try to maintain safe spaces. We're working on plexiglass dividers for when the time comes for our students. We've replaced water fountains at every single campus with water bottle disposal units. We've ordered bottles for some of our students. Certainly if you're interested in purchasing a bottle for your student, we encourage you to do so as part of the back to school effort. There will be much more information about technology and technology distribution coming soon. Again, we'll post that to social media. We will put that on our website. We will release that to the media and ask that everyone help us spread the word when that time comes. Lastly, just a quick personal moment, just to kind of put the frame of reference where I think it belongs. I've been a piano player my entire life, a singer and a musician. I started when I was very young. I loved it so much as a kid growing up that I decided to study it in college, and I ultimately became a music teacher before I was a principal and finally a superintendent. I still continue to this day. I love playing the piano. I'm working on a new song right now, as a matter of fact. It's coming along. I'm not great at it yet, but I'm still practicing and getting better every day. Recently, as part of this process in learning this new song, it dawned on me that that's really the moment we're all in right now. When you're first starting something and it's not great, and then you work on it and you get better. 35 years as a practicing musician has taught me the importance of practice, the importance of a positive attitude in learning, the importance in believing that you will ultimately figure it out and make something that's not great, great, and mostly the importance of grit, just sticking with something when it's really, really hard. That's really what we're doing now in schools. We've gone through a massive learning curve through the spring. We spent the summer reorienting ourselves and getting better. We're going to spend the next several weeks with our staff getting better still and practicing with the hope that we can have a great start to our school year. And I'll ask you, everyone who's listening, to reflect on your own personal learning path and remember that you've learned these skills as well. whatever your endeavor is through life, you've learned these very same skills, and they are critical for our success together. Thank you for your time, and certainly we would take any questions that you might have.
Dr. Shepard, one of the major barriers for families throughout the country is childcare for children who need supervision. For those families who have young children at home that are going to be engaged in virtual learning, what should they do? Are there any plans to accommodate them or assist them with childcare?
Under this order, we're not going to open up the schools for childcare purposes. That's just not going to be an option for us. We do understand that. We understand the. I don't think of schools necessarily in the frame of childcare. The way I talk about it is that we serve a custodial function. That is, we are a place for kids to go so parents can go to work. I understand that, and that's a reality for us. I'm hopeful that when community spread begins to drop down, that we will be able to quickly reopen our schools in a way that's safe for kids, and we can get back to something that seems more normal.
Okay, but at this point, families should figure out on their own any adjustments they need to make to their work schedules or anything else to be there for their children if they need to be.
At least through September 7th.
Will meal distribution continue? For families that rely on the district for meals?
Great question. The question about meal distribution, will that continue? Yes, it will. Our nutrition staff, they've been working tirelessly, as our entire community knows. They're going to take a short summer break to recharge their batteries just for a few days, really. And then they're coming back to school for meal distribution. We will continue to feed our kids and our community.
Dr. McNeill and Dr. Shepard, is there a chance this order could be extended, and when and how will that decision be made?
I wanted to add that we do have our city attorney, Thomas Gush, in the room, who did develop the order, and if he would like to address that question, he can.
Yes, ma'am. Thank you. And I hope that this microphone is picking me up. The order includes a provision that districts must develop a plan 2 weeks prior to their reinstituting face-to-face instruction, and so that plan would be submitted to the local health authority, and any decision to extend these orders would be made at that time.
Thank you, Thomas.
Dr. McNeill and Dr. Shepard, could you speak to why you thought an order was the best way to address this issue instead of any other measure that we could have taken?
Well, I can tell you then, I'm sure he'll have something to add to it as well, but I can tell you this is not a decision that was made lightly, and it was not one that was made easily or quickly. We looked at a lot of different factors. We looked at a lot of different things. The biggest thing is that we are in widespread community transmission, and Texas, Louisiana, Arizona, these are all states that are in trouble. So we never thought that we would get like New York, but Houston is pretty close right now. So, and that's just right down the road for us. That there were a lot of thoughts about that, and I always had trouble thinking about, basically from my own standpoint, of being able to tell people that we can't have groups of 10 in one place, but we're going to send 30 kids in one classroom and let them sit there for 8 hours and breathe the same air. So that was kind of hard to understand. And then 2 days ago, a study came out from South Korea, and it's a really good study. I mean, they looked at almost 6,000 kids with COVID, and then they did contact tracing on approximately 57 to 60,000 or 60 to 65,000 people, and they looked at this, and they basically found through this study, and I think it's pretty legitimate. I really looked at the numbers at it, and what the data says now is that from age 0 to 9, that there is a decreased risk of transmission from and to children. But at age 10 to age 19, the rates of transmission are identical to that of adults. So you're basically talking about fourth graders and 4th through 12th having the same rate of transmission as the other people that we're telling not to be around each other. So when I saw that, that was pretty much one of the final things. Interestingly enough, too, they looked at the age 0 to 9, and they looked at the small children. And when they factor in the fact that it's hard to tell small children to wear your mask, it's hard to tell small children, and I have 3 of them, and I know, they don't stay away from each other. They run around, they hug, they play, and they do things that kids are supposed to do. So when they looked at that, there were some theories, this was not proven, but there were some theories that the rate of transmission in that age group would probably be offset by that, and it would probably be similar to what the older children's rate of transmission was. So basically, we looked at a situation and we said, It's terrible right now. It's widespread community transmission. We're hoping that it levels out. We're betting on that, and we're doing everything we can. But remember, everything we do right now takes 2 weeks for us to see. So it's going to take a little while to know for sure, but we're hoping that it goes down. And trust me, I want my kids back in school too. And I know everybody wants their children. It's great for a lot of great reasons. The final thing I want to say is that there was just a study, or not a study, but there was a statement released from the American Academy of Pediatrics in Florida. Y'all probably saw that. 2,600 physicians, pediatricians, sent a letter to Governor DeSantis, and they recommended that school not be restarted in early August. So if it's good enough for the American Academy of Pediatrics in Florida, then it's probably good enough for our kids here in Victoria, Texas.
Dr. McNeill, in light of that study and potentially the advent of more data, would it potentially be an option then to tailor the approach when schools do reopen based off the data from those age groups? Essentially, have a different policy for kids younger than 9 and older. And as a follow-up, what, if any, information did that study provide about the transmission from those younger kids to teachers or adults, if that was?
Well, that's a very good point. Asking about what about the transmission from those young adults to, or from the children to adults. We live in a multi-generational family age, so grandma lives at the house a lot of times with the grandparents and the parents, and if these kids can transmit it as easily as any adult, then they could very easily bring it home to their elderly family members, and that was a consideration as well. Now, as far as the issue of being able to modify things, I'll let Dr. Shepard talk about that, because he's very good at modifying plans on the move, and I suspect that will probably have to happen. We don't know exactly where we're going to be, so we don't know exactly what we're going to have to do, but we've already started talking about it, I will tell you that.
Yeah, I would echo those statements. Dr. McNeill and I are in regular contact, not quite daily, but pretty close.
Yeah.
What he and I both agree on is that we don't want to be in a situation of what I've called competing authorities, where his voice takes center stage or my voice takes center stage. I think that's ultimately unhelpful to the conversation. I think he and I would both rather be coordinating authorities, which means that I defer to him on matters of health expertise, and I know he has deferred to me on matters of education. To that end, we are working together to come up with something that makes sense for all of us, that meets the safety needs, that would meet community spread considerations, and certainly education.
Dr. McNeill, just to clarify, so there is no current order or mandate for child care facilities for young children, for daycare facilities and the like?
I do not know of one. Do you know of one? There's an attorney in the room. I can look at him.
Thomas is shaking his head
He's
no.
shaking his head no, so I'm going to say that there's definitely not.
And just to confirm, for folks listening at home, what we know about transmission rates, although it appears the recent data indicates that 10 to 19 transmit the same way adults do, current data indicates that children will have less severe outcomes than adults by and large. Is that fair to say, or how would you counsel parents?
No, that is fair to say. That is fair to say. But then you get into the game of what does that mean? I mean, to me, one child dying is way too many. So I look at it like that. There may be other people that look at it differently from a different standpoint. But as local health authority, all I have to do is look at health and public health. And my public health says that one child getting that sick, and I have seen sick children from this, and they're out there. So, and we've seen, we know of deaths that have occurred. So I think that that's one issue, but I think the bigger issue is when this transmission thing came out, and the fact that we have multi-generational living, and we have people that go out in the community, and children are out in the community. They go to their friend's house, and their friends have elderly parents. We're just talking about more vectors, and just more vectors of transmission. And anything that we can do to slow the transmission and thus decrease those numbers of vectors and thus slow the transmission is a good thing. And that's what this order accomplishes. So.
We have time for maybe one more question.
Dr. Shepard, can you just address what remote learning will mean for special education? How will those students be
Yeah, there's multiple groups of students that we want to make sure are getting an education in an appropriate way. So each of our departments is going to begin reaching out to families uniquely. You bring up special education, ELL and bilingual are another big concern for us. So we're going to be reaching out to families directly so that they know what to expect.
Thank you so much for your questions. If you have any others, you certainly can address them after the briefing. In the meantime, I will summarize kind of some of the main points that were discussed, and that was a lot of good information from Dr. Shepherd and Dr. McNeill. Virtual start for students begins August 18th. All of this information, of course, is available at visd.net. Dr. Shepherd encouraged people to register as soon as possible, if you haven't already, and accurate survey data will help determine who needs an actual device. One thing he said is if you're able to purchase a device, it means someone less fortunate may have access to a device that they will be providing. So that's very important. Again, this information is available at visd.net. To summarize again, Dr. McNeill addressed some misinformation that was out there in the community, that's out there in the nation really. And he reminded the public to follow Governor Abbott's orders to wear a facial covering when in public. These masks are effective in preventing the transmission of COVID-19 in our community. Dr. McNeill has signed an order to ensure that public schools offering non-religious education within the Victoria County will suspend in-person classes through September 7th. We will update our website and social media pages with new case counts from today, this evening, once ongoing investigations are completed. For more information again about VISD, visit visd.net, and any other information related to COVID, visit victoriatxoem.org, where the full order from today will be posted. You can also contact our COVID hotline at 361-580-5796. Thank you so much for viewing. Thank you again, Dr. McNeill and Dr. Shepherd. We appreciate your time. Thank you.